This will be first of a series of videos that will identify structures right here at the brainstem, and we will also try to identify related structures such as the cranial nerves. Most of them will arise from the brainstem. So this part right here forming something like a stalk for the cerebral cortex. And we have one on the left side right here, another one on the right side. Those are the cerebral peduncles, which is actually part of the midbrain. And then this large structure right here, very prominent, that is the pons. So we'll also identify vessels, arteries that are very visible here, and vessels that we can use as landmark for the structure. So right here at the center, that's the basilar artery. Actually, there's a shallow groove at the center of the pons. That is the basilar groove. The basilar artery, as you can see right here, it is formed by the union of the vertebral arteries coming from both sides. So this is the groove between the pons and the medulla oblongata. And then right here at the center, that's the anterior median fissure of the medulla oblongata. The swellings lateral to the fissure would be the pyramids. And then this swelling lateral to the pyramid, this is called the olive, no? And then we have another swelling right here. That is actually the inferior cerebellar peduncle. It's like the stalk for the cerebellum, inferior cerebellar peduncle. No? This large structure, lateral aspect of the pons, also connected to the cerebellum. That's the middle cerebellar peduncle. So as mentioned a while ago, we'll also identify cranial nerves that will arise from the area. Let's start with the more visible ones right here. This one is cranial nerve number 6, abducent nerve. It arises at the groove between the pons and the medulla oblongata. So if that is cranial nerve number 6, we have here actually a bundle of nerves. We have 2 cranial nerves in this bundle. If that is cranial nerve number 6, abducent nerve, this will be cranial nerve 7-8 complex. So cranial nerve 7 is the facial nerve. It is more medial. And then the more lateral one would be cranial nerve 8 or vestibulocochlear nerve. Not clearly visible, but you can see actually this would be a large nerve root arising at the lateral aspect of the pons. That's the nerve root for the trigeminal nerve, cranial nerve number 5. So arising in between arising at the groove in between the pyramid and the olive. That's supposed to be the hypoglossal nerve roots, no? Cranial nerve number 12. And arising at the groove between the olive and the inferior cerebellar peduncle should be cranial nerves 9, glossopharyngeal, rootlets of cranial nerve 10, which is vagus nerve. No? I believe, no? Some of these nerve rootlets we can see right here belong to the nerve rootlets of the vagus, no? And from the more inferior, no, part of the groove will be the rootlets of the cranial component of cranial nerve 11 or accessory nerve. There's actually another specimen, no, that we can view, and 9, 10 nerve rootlets are more identifiable and visible. So let me direct you. Let me spread this open. So this meningeal structure, once again, is the tentorium cerebelli. No? Let's try to pull that aside, because I want to show you one cranial nerve. It's the only cranial nerve that will arise from the posterior aspect of the brainstem, unlike the rest, which usually will arise, no? Anterior from the anterior or anterolateral aspect of the stem. So let me get in. Let me try to give good exposure. So you can see there is a vein right there, dark colored blood vessel, oriented or positioned vertically, and then you have a very thin nerve. You have a small nerve right there. I hope you can see that one. It arises from the posterior aspect of the midbrain. Let me zoom in to the area. The image will get a little bit grainy, but there it is. No? It's more visible right now. You can see it's really a nerve. No? It's solid, unlike the blood vessels, no? Artery and vein, which really looks hollow and luminal. So I guess we have not identified this nerve yet. This is the trochlear nerve, or the fourth cranial nerve, no? Which controls one extraocular muscle, which is the superior oblique muscle, no? Of the eyeball. The other vessels will be described or discussed in a separate video.